Hi there. Today we'll be looking at diabetes. Let's examine this schematic. So when insulin is present, it binds to this insulin receptor, which then activates glucose transporter 4, which brings glucose into the cell and can convert it to pyruvate, or it can be stored as glycogen. So what is diabetes? Diabetes is the most common metabolic disease. It is the inability to control sugar metabolism. It is characterized as a disease in which the body has a hard time producing and responding to insulin. So insulin is a peptide hormone. It is made in the islet of Langerhans, which is found in the pancreas in the body. There are two types of diabetes: type 1 diabetes, in which not enough insulin is made, and there's type 2 diabetes, which is the resistance to the effects of the insulin. So let's look at type 1 diabetes. Type 1 diabetes is mainly an autoimmune disorder. It's characterized as low insulin levels and high levels of glucose in the blood. The diagnosis is high levels of sugar in the urine. Because if we go back to the first slide, we can see that if there's no insulin, that means insulin cannot bind to this receptor and therefore cannot activate this glucose transporter 4, which cannot let glucose into the cell to be metabolized. So glucose can go in the cell, it remains out and gets excreted in the urine, or it can remain in the blood as high blood sugar. The body responds to low insulin levels as if it is starved of glucose, and this causes a large release of ketone bodies from the liver, and ketone bodies are able to lower the blood pH below 6.7, which is not a good thing at all. And low levels of insulin can cause the body to digest its proteins. And now let's look at type 2 diabetes, which results from insulin resistance. And type 2 diabetes is the most common form of diabetes. And the causes are almost all post-receptor, which means that the problem occurs after the interaction of the glucose, of the insulin with its receptor, such as the failure to activate glucose transporter 4. So it's always post-receptor. After the insulin is bound to the insulin receptor, after that interaction, it's what happens next that is failed. And type 2 diabetes causes hypertension, hypocholesterolemia, hypercholesterolemia, and neuropathy. Type 2 diabetes can be controlled by diet, drugs, or insulin. And this is just another illustration of the main symptoms of diabetes. In the blue, I believe, it's the symptoms are more common in type 1. And that's it. Thank you for watching. Hope you found this video very useful. Please like and subscribe. Thank you.